All right. Thank you for staying with us this far. We are glad you are with us. In case once again you're joining us, karibu tena sana. We are glad you have chosen to start your morning with us here on Good Morning Kenya. I am Jain Wambui. This is Good Morning Kenya. Of course, you can let us know where you're watching us from today. We are using the hashtag Good Morning Kenya on Twitter. Our official station handle ever remains to be at KBC Channel 1 across all the social media platforms. My handle is at Jain Wambui. So today we start off with our health segment. Contrary to how we usually do it, we usually have people in politics, but today we've switched things up kidogo here and there. But that is that. In regards to health, today we are going to be focusing on cancer treatment here in Kenya and just generally looking at how we can transform cancer healthcare, and especially when it comes to the delivery in the Kenyan space. Now, before I even introduce my guest this morning, let us set the stage and just look at the numbers as is. So, looking at cancer on a global scale, the cancer burden is estimated to be about 85% in sub-Saharan Africa. It is actually estimated to grow to 85% in sub-Saharan Africa by 2030. Mind you, we're in 2022, okay? Now, looking at developing countries, they bear 80% of the global cancer burden. And when it comes to resources that are allocated to cancer treatment, only 5% is directed to this particular group, and that is developing countries. Now, let's bring it further into Kenya. Looking at our country, cancer has been identified as the third leading cause of death, and this is after infectious and cardiovascular diseases. And the cancer burden, looking at the cancer incidence, the figures currently stand at 47,000 cases annually, a little over that figure, and the mortality rate is at about 32,000. This is over 75% of this particular figure, meaning 75% of people do not survive cancer here in our country. So what is being done to just ensure that we are redirecting more resources and more conversation towards addressing the cancer burden that we are experiencing as a people here in the Kenyan space? Well, to help us with this conversation this morning, we have two gentlemen with us. I'll start with the gentleman to my extreme right. He is Dr. Joseph Lanai, who is the Director of International Health Relations, working with the Ministry of Health. Good morning.
Good morning to you, Jane.
Thank you for making time to be with us today.
You're welcome.
And right next to him, we have Professor Graham Lord, who is the Vice President at the University of Manchester. Good morning and welcome to the program.
Good morning, Jane. A pleasure to be here.
Thank you for making time to be with us today. Now, let me start with you, Dr. Joseph. You know, when you talk about cancer treatment in Kenya, it's still something that so many people have a lot to say about it, but we need to just take stock and see where we are as a country. So from what you know under the ministry, where are we as a country when it comes to cancer?
Thank you so much, Jane, and thank you, our great friend, Lord Graham. Welcome. In terms of cancer, I think there is a big concern that when you look at the incidences of cancer, there is tremendous increase on the numbers that are being reported.
Yes.
Like when you look at the Global report, this is a report which is produced by the International Center for Cancer Research. You find that 2012 we had around like 38,000 cases which were being reported annually. But by 2018 we are reporting like 47,000. This shows there is tremendous increase, and equally also a third of these also end up dying. So when you look at the burden, is tremendously increasing, and hence for the call that we need to rethink about cancer. Look for internal solutions, and also at the same time look at the global solutions.
Yes.
And that's why Kenya has partnered, the Ministry of Health has partnered with the Kenya-UK Alliance in order to take our healthcare and also training to the global level.
All right, beautiful. Now let's come to you, Professor Graham. You know, just to give us a brief background in regards to cancer treatment in the UK. What are the figures looking like?
Well, as you said, cancer globally is a growing burden, and actually you often see more cancer as societies get older. We've had a big focus in the UK over the last 10 years about prevention and early detection of cancer.
Yes.
So part of what our partnership is around is how we learn from what's happened in the UK around prevention and early detection and how we bring that to all the people of Kenya in partnerships across the two governments. As you said, in Kenya there were sort of 48,000 cases in 2018 and 33,000 deaths. What that means is that sort of 7 in 10 people that get diagnosed with cancer will die of cancer. Most of that is because of late presentation. We know that if you can prevent or detect cancer early, you can treat it and the survival is much better. And so in the UK over the last 10 to 15 years there's been a big focus on that prevention and early detection. I think what we've found over the last 2 years has been a bit of a fallback from that during COVID. So we have a lot also to learn from the work that we're doing with our Kenyan friends and partners about how prevention and early detection can be done for the whole population in a sustainable way.
All right. Now, we know that health is one of the pillars under the Big Four agenda for the president. And looking at cancer specifically, it's one point that so many people have been struggling with. So comes this particular alliance and this partnership that we have with the UK. What is the background to it? Let me start with you, Dr. Joseph.
Thank you. What you find is that in the Big Four agenda of the president, one of the key pillars is universal health coverage. And of course, we have been fighting with infectious diseases, but with the time you are seeing the reverse, that the trend of infectious diseases is coming down, while the trend for non-communicable diseases is coming up. So even in the president's agenda, and even in the Ministry of Health, we are concerned about cancers, hypertension, mental health is also coming in. So we are looking for solutions internally and even externally. So deliberately, the president, when he went to UK, he has been to UK severally, and last year he was actually there twice. And in July last year, on 29th, we signed an MOU in front of the president and also the Prime Minister Boris with partners in the UK and looking at two key things. How do we establish a center of excellence on cancer diagnosis, treatment, and even further management, which is at the global level? Then again, how do we establish a ripple effect where we are injecting this knowledge into the training such that even the people that we produce at the end of the day are oriented in a global approach to cancer issues. So this is a deliberate move by the president himself and also a deliberate move by the Ministry of Health led by the CS and the PS in order to rejuvenate and reinvigorate issues pertaining to cancer. And this journey started. I think we'll be able to tell you more of what we have been able to achieve.
Yes, and that actually brings me to the gaps that, you know, actually necessitated for such a partnership to come into play, looking at cancer treatment and the general conversation around cancer in Kenya. And I'd like for us to just have a quick conversation around those gaps. And the first one that you've just mentioned is when it comes to the healthcare workforce themselves, the human resource, when it comes to their training, to just make sure that it is on a global scale. Let me start with you, Professor Graham. You know, looking at what you have seen with the professionals in your country when it comes to how they deliver treatment and diagnostics around cancer, what are some of the notable differences that you saw that, you know, could be transferred in terms of knowledge to the Kenyan professional workforce?
I think what we see globally, actually, and obviously including the UK and Kenya, is at the moment we have a shortage of supply of healthcare workforce, whether that's doctors, nurses, radiographers, allied health professionals. So actually in partnership with Kenya, we're looking to see how we can address that workforce gap. So this is a global problem. Clearly it's important that people are trained across the whole healthcare workforce to the highest global standards. And I think as my friend said, that's really important as we develop this partnership, that everything we do is the best in the world, and Kenya leads the world in this area. So one of my jobs, I'm the Dean of the biggest medical school in the UK, and obviously we train our doctors to a very, very high standard, as you do in Kenya. But I think how we learn through that medical curriculum, and it's not just about doctors, but this is the example that I'm giving, is how we train our doctors for the future as well as for now. I think what we've found in terms of the universal health coverage we have in the UK, which we call the National Health Service, which we're very proud of, we have universal health coverage, which aligns very well with the President's Big Four agenda of universal health coverage, is how you do that in a sustainable way. And what we want the healthcare workers of the future to look like might be different from today. So again, we're learning from our partnership with Kenya about that, about how we focus on public health, prevention and early detection for the future, because that's how you make a healthcare system economically sustainable, and critically how you diagnose patients with cancer earlier.
Thank you. In addition to what Professor is saying, actually the gap is not at the primary healthcare level, though we need to capacity build our nurses, our clinical officers, who are the front line in the dispensaries and the health centers. That one we are able to do on early detection. The whole thing is, yes, we have been training oncologists. We have been training maybe other people. What you find is there is some super specialization that is required, especially at the physicist. There are people who are called physicist level. There are also specialists who have specialized in certain types of cancers in certain regions of the body or organs of the body. Like a specialist specializing in esophageal cancer just alone, you know, at the fellowship level. Pancreatic cancer alone at the, you know, fellowship level beyond masters. Maybe cancer of the liver, speciality in that. That is what we are looking at.
And that's where there's a gap as well.
And that is where there is a gap. Like in Kenya, we have only 7 physicists. What we are looking at is even this collaboration as we continue, putting radiotherapy machines in Mombasa, Nakuru, Garissa, apart from the ones that we have in Kenyatta and also Moi Teaching and Referral Hospital. How do we expand that specialization level?
Yes, and that is actually touches on a conversation that we had a while back here on Good Morning Kenya. There's a time we hosted a 7-year-old girl who was had cancer of the throat, and she couldn't get specialized treatment in Kenya. She had to consult with the doctor all the way from India. So again, that's clearly a gap that needs to be that has been identified.
Then, Jain, we are not waiting for until we train our own.
Yes.
What we are looking at, how do we get hold of their professors to come over, their specialists also to come over, and also embracing technology currently.
Yes.
We are doing a lot of telemedicine between Kenyatta University Teaching and Referral Hospital and Manchester University and Christie Foundation Hospital.
All right.
So even they are attending to patients while a specialist from Christie and Manchester is looking at it, at that patient, and even they go through the history, through the diagnosis, and even agree on the laboratory, and even when the results come out, they agree on what is the mode of management. So that is already happening through the UHC agenda.
All right. Now, this is all in line with this partnership that Kenya has with the UK just to make sure that healthcare is no longer a route to poverty that many people have been experiencing. Now, we want to take a very quick breather. We will be back to continue with this discussion. Again, feel free to interact with us using the hashtag Good Morning Kenya on Twitter. Welcome back. We continue with this health conversation all about looking at how far we've come when it comes to cancer treatment in Kenya and what more we can do as a people to just make it a smooth journey for each and every individual. In studio this morning, we have Dr. Joseph Lanai, who is the Director of International Health Relations working under the Ministry of Health. We also have with us Professor Graham Lord, who is the Vice President at the University of Manchester. Now, let me come to you, Dr. Joseph, and still looking at those gaps that have been identified, and the biggest one that I believe so many Kenyans and even you can resonate with is when it comes to the diagnostic centers for these services and treatment. It is something that so many people complain about. They have to travel from so far just to come to the urban setups to get treatment. What is being done in regards to this?
And even not just that. You remember those eras of you come to Kenyatta National Hospital, you are booked to be seen 6 months down the line.
6 months later, yeah.
Now that has become a thing of the past since we have opened the Kenyatta University Teaching and Referral, PET and SPECT-CT scans over there. We have also opened, you saw the president opening one in Mombasa.
Yes.
Soon we are going to open one in Garissa and Nakuru. In fact, at the end of this month, we are going to open the one in Nakuru. And we already have a radiotherapy also machine in Garissa. The same thing is going to happen even to Jaramogi Oginga Odinga Hospital in Kisumu. We just commissioned the construction of the building the other day.
Yes.
So the whole issue of UHC is addressing the issue of access, and of course you avail quality services. Now we are decentralizing these centers. Apart from having maybe a hub, and that is what we are partnering with the Kenya-UK Alliance, having a hub at Kenyatta University Teaching and Referral Hospital, but with the spokes. Which are these spokes? One, we have a spoke at Egerton University, of course working in collaboration with the Nakuru Provincial Hospital. We have a spoke at Maternal University, which is working in collaboration with Jaramogi Oginga Odinga Hospital. I spoke at Masinde Muliro University, working with the Kakamega Level 5 Hospital, and Kisii University, working closely with the hospital which is there. Now, for the cancer, we are looking at a very big hub, which is already established at Kenyatta University Teaching and Referral Hospital, but mentoring those spokes. But equally, Kenyatta is being mentored by the Manchester and Christie Foundation Hospital, who are here now to go and reinforce that hub and spoke model in order to see to it, to take it to another level.
All right. Yeah. And that actually brings me to you, Professor Lord. Looking at the question of access to cancer treatment in the UK, how has it been done to ensure that I can get the services to a center that is close to me? I don't have to travel kilometers just to get screening services.
So a great example, and this is what we're working very closely with our friends at Kenyatta University Teaching Hospital and across the whole of Kenya, is how we have a network of cancer services for diagnostics and treatment within Greater Manchester and also across then the whole of the UK. So wherever you are in Greater Manchester, whatever district you're in, you'll get the same treatment as if you went straight into our hub, which is the Christie Hospital.
Quality?
The same.
The same.
Absolutely the same. And I think the other thing that we've spread that network out even further in terms of the prevention and early detection is actually Manchester has pioneered for the UK and also for the world how we go out and into the community. So we have mobile units and take CT scans and early diagnostics out, even out of hospitals and beyond primary care to where people are when they have some symptoms. So maybe it's a cough, so we'll go and talk to them and give them an early diagnostic to try and prevent lung cancer, for example. So there's a network effect, so you get a minimum standard whichever hospital you go into, and then there's a community effect to spread that network out. So that's how you start to build universal healthcare coverage for cancers, for specific cancers, but also if you build a healthcare system in that sustainable way, it's also useful for cardiovascular disease, for mental health, or even prevention of infectious diseases.
It spills over both
it spills
other
over,
diseases.
yes.
And borrowing that, what we are applying in the universal health coverage for the president is looking at even those spokes that we are talking about. How do they serve the communities and the counties which are surrounding?
And especially given health is devolved.
Exactly. Yes. Looking at Nakuru, it should be able to serve Baringo, Laikipia, serve Nyandarua, and even Narok, you know. So we have on community health strategy. In Kenya, you know, we do have those community health volunteers who are there. So in terms of prevention, early detection, as I said earlier on, apart from building capacity in the health centers and the dispensaries of frontline health workers who are the nurses and the clinical officers to detect early, we are also building those who are taking care of the households, who are the community health volunteers. There is already a package. And in addition, you know about the family medicine doctors that we sent to Cuba. They are already back in the country, all of them. And what we are doing is all of them are going to be positioned in the counties and they will be working on what we call the primary health care network, all the way to the household, looking at dispensaries, health centers, up to the community health level.
Now, let's come to the financial aspect of cancer treatment. You know, they say so many Kenyans are one medical bill away from poverty. And the main goal of UHC is to ensure that every Kenyan gets quality healthcare services without going financially broke. Now, looking at cancer treatment, we know it's not cheap, but how is it being factored in the UHC to ensure that we get that world-class service to each and every Kenyan at an affordable price? Let me start with you, Dr. Joseph.
Thank you. Since we opened 4 months ago, the Center for Cancer Treatment in Kenyatta University Teaching and Referral Hospital, the center has already attended to more than 300 people within 4 months. What you find is that these are people who could have traveled to India. And what does that translate to? Give it an average of like 2 million is what they could have used to go to Mumbai and other hospitals. So that is, within 4 months, those families have been saved 0.6 billion Kenya shillings. I think he'll tell you, even the statistics that we have, is like we save like 12 billion annually Kenya shillings. We'll save 12 billion Kenya shillings if we decentralize that. And in addition, what are we doing? All these centers that we are establishing, we are also packaging the NHIF package for cancer treatment, management, and even diagnosis. And how is it? All issues pertaining to cancer, from diagnosis, what we call the cancer journey, is being taken care of by NHIF.
In the oncology package that they offer.
Yes, and even we saw testimonies when the president was opening there, with just 6,000 shillings a year, or even 500 shillings a month, or 17 shillings a day, which is actually an egg a day. You are able to attend or get services which are equal to maybe more than 2 million. So we are encouraging also Kenyans to take NHIF because that's the sure bet in order to not to face that financial handicap that comes with cancer.
All right, and just to also hear the same when it comes to the financial aspect, looking at the National Health Service in the UK, how has it been made affordable for all citizens to be able to access quality medical care without fearing the cost implications that would come with that?
Well, so as I mentioned earlier, our National Health Service is essentially universal health coverage. So that was founded in 1948 and with the fundamental principle of free access, free at the point of use. So in the UK, because of the NHS, nobody pays for their healthcare. It's paid for centrally by the government through taxation. So nobody in the UK ever gets a bill for medical treatment. And that fundamental principle and those set of values, which is why this Kenya-UK Healthcare Alliance is so important, because it's about those shared values. What have we learned? How do you make that system affordable? Because somebody has to pay for it. It's either the patient or the government, and actually the people are still paying for it through the government through taxation. It's just not, there isn't that direct transaction. So as you say, so nobody in the UK is one bill away from bankruptcy. And that's how we're going to try and work with our friends in Kenya to say, this is what you need for universal health coverage, because that worry for everyone is just unacceptable. And that's why I think this Big Four agenda that the President is launching is so important.
Yes.
And the deliberate things that have been done already.
Yes.
Not everyone, of course, can pay for NHIF. We are identifying those who are very poor, what we are calling the indigent population. And NHIF already has them in the system. We are going to pay for 1 million people this year, this financial year, for NHIF. So apart from people taking NHIF, government is also deliberately looking at the poor of the poor, who we should be able to pay for. And we expect to escalate that to around 5 million in the next 5 years.
All right. Now, we have been talking about this Kenya-UK alliance. Maybe somebody is watching and wondering, okay, what is this? When did it happen? It is an agreement that was reached last year in July between Kenya and the UK government. And maybe you could give us those details. Also, we could also get to hear from the UK side of the divide for the benefit of our viewers once again.
The relationship between Kenya and UK is that of a mother and a child, let me call it, that it is so intimate. We have had a lot of good relationship from colonial time and even post-colonial, but this has taken us to another level. The coming together of the Kenya-UK team and universities and individuals has taken our conversation to another level. Now, this just started from the side chats of the president himself and the Prime Minister Boris, where we saw there is a need to have the universities within UK, especially Manchester and even Christie Foundation, to team up, partner with institutions back in Kenya to take this issue of healthcare and UHC to another level.
Yes.
Now, we signed an MOU last year on 29th of July, and this is what we are here to oversee. What have we been able to achieve, and even come and reinforce further the spirit that was there, maybe.
Yes, just to add on to that, how do you feel even UK can benefit from this partnership with Kenya?
Well, I like the way you put the mother and child relationship. I might actually put it the other way around. I think the UK has as much to learn from Kenya as the other way around. That's why it's a real equal partnership, but it's led by Kenya, which is why it's the Kenya-UK Health Alliance, not the UK-Kenya Health Alliance. Yeah. So that's very, very important. We have a huge amount to learn about how you build a sustainable healthcare system almost from scratch. In the UK, we're trying to retrofit all of these new ideas, whereas actually in Kenya, we're doing it, getting it right the first time.
Yes.
So we have a huge amount to learn about how we make that affordable and sustainable and how we reach every person in the population. I think more broadly, the UK and Kenya, as you say, have always had a very strong relationship, and we're now reinforcing that relationship, and it's built on friendship, trust, but also a real shared ambition to bring the best global healthcare to every person in Kenya and every person in the UK.
All right. And Dr. Joseph, what would you say are the priority areas for us as a country in line with this partnership? And you can actually just maybe give us a status update so far, what has been done in line under this partnership, rather.
Thank you. We are focusing on two major areas.
Yes.
Mainly establishment of centers of excellence for cancer care. We are also looking at establishing center of excellence on health education and training and production of workforce who are resilient and able to respond to the needs of the nation. In addition, again, of course, we are not just stopping there. We are still exploring in other areas where we can be able to collaborate. Things like vaccines production. We are looking at manufacture of pharmaceuticals. We are also looking at even genomics and genomic sequencing issues. What you find is that even the drugs that we use here in Africa, most of them have not been tested, or clinical trials have not been done with the blacks. So to us, it's also an opportunity to be able to do more research, especially on diseases and pharmaceuticals and even clinical trials, especially in the blacks, because most of these things have been done in the Caucasians. Mental health, of course, we are collaborating with others, but it's also a field to explore. There is already a conversation going on between Mathare Hospital and Oxalis Health Foundation. So those are the things we are looking at. And of course, post-COVID, what are some of the things that we can be able to take to another level?
All right. Yeah. And speaking of taking things to the next level, when it comes to exchange programs, how is that also being factored in to just make sure that even the transfer of technology is, flowing seamlessly between Kenya and the UK?
We've already established, and in fact it was something that I announced with the President in July of last year when we signed the MOUs. We've already established some scholarships, the Jomo Kenyatta scholarships for students from Kenya to come over to Manchester. We have a number of exchange programs for the reverse to occur as well, and actually part of our visit this week is to try and establish the firm foundation for that, so that more and more people can come over to Manchester, learn about medical physics. We can then combine that with sort of telemedicine and hybrid working, so that we make this a very sustainable partnership.
Yes.
I think the other aspect of the partnership that I should emphasise is how we're partnering on research, and particularly as you mentioned around genomics, there are lots of treatments that are given to an African population that we don't know how effective they are, because as you say, they've been tested in Caucasian populations, and we know that the genetic background is very different, but we don't know how it's different and how that affects treatment responses. So that feeds into the other part of how you make a sustainable healthcare system. If you're giving treatments, you need to know that they work. You need to know that they're effective for them to be cost effective. So we have a very, very deep partnership with researchers in Kenya and in the UK around, particularly related to cancer. What are the causes of cancer? How can we treat it better? Because actually if we treat it better or we diagnose it earlier, it's also cheaper, and that's when you can cure patients. So there's a very holistic partnership for the Kenya-UK Health Alliance that covers a lot of areas.
R&D is always a critical area, and it's actually a very big gap. We had a conversation a while back with the Mary University still focusing on research and development. Now, looking at technology in terms of keeping up with the times and the fact that we acknowledge the fact that there's some specialized cancers that require specialized treatment, and those professionals could not be in the country, therefore coming in the whole aspect of telemedicine. How is it being factored in to just make sure that every Kenyan can actually get these services from a professional who might not be in the country, but they don't have to, you know, travel all over the world just to get the services? Telemedicine being adopted in the health facilities.
This was even started before even the MOU was signed, in that Manchester University signed an MOU before, even with the Kenyatta University Teaching and Referral Hospital.
Yes.
So the point is that the first win that they had was establishing the telemedicine network, where they could see patients together, diagnose together, and even agree on the management. That has been ongoing. And there is already a platform in the digital platform for MOH where they are riding on that. Now, in addition to that, what you find is that now Kenyatta University is supposed now to start with the spokes that we have over there. Of course, we are embracing technology in this era. It goes even to the extent of even sharing things like radiological imagings and so. So we are looking at the whole spectrum of health where we can be able to share with specialists on the other side.
All right.
And there are testimonies even by patients that are true. Were it not for even that collaboration, would have not gotten where we are.
Now, the question of awareness is something that we cannot fail to address, just making sure that all this information that we are having here gets to each and every citizen, the common mwananchi. And looking at the UK, what has been done to just make sure that this information flows seamlessly between the professionals and the citizens, that they know if I need this type of service for this cancer, I can get it here, and I know the steps to take to get this service?
In the UK, we have a system of sort of primary care, which is usually the sort of first point of contact for patients to go to a general practitioner, and then there is onward referral from there. But actually, and I emphasise, we have a lot to learn from our Kenyan partners here, because that information flow and understanding, making patients understand what the early symptoms of disease are, is absolutely critical.
Yeah.
So actually part of that information flow is doing interviews like this and telling people about the symptoms and what facilities that they can access. In the UK, we do a lot of work around digital sort of apps on people's phones to get information out to them. This is a developing area. And again, to my earlier point, this is where we're going to learn a lot from our Kenyan partnership, because actually in terms of that digital infrastructure, Kenya is much more advanced than the UK. You have universal 5G coverage. So how you utilise that in this partnership to get information out to patients through their phones and different functions like that is going to be really important.
Yes, because that's the other area of concern, where people seek treatment when it's a bit too late, yet the symptoms have been manifesting. They have been taking over-the-counter medicine to just deal with the pain because they do not know this information or do not have access to it. What is being done to this end?
I think knowledge is the first remedy in terms of prevention. And when you look at the statistics that we have, breast cancer leads in Kenya, followed by cervical cancer, esophageal cancer, then prostate, then colorectal. Now, I think it's very, very important for people, one, to embrace change of lifestyle in order to prevent.
Yes.
Now, what are some of the things that we are telling people to avoid? Things like alcohol, things like smoking, they need to avoid all that. In addition, again, you need to do self-breast examination, and when you find a lump, kindly don't assume, because most of the cancers, sometimes they are painless. You are just having a lump and it is painless. So it's good you take precaution as early as possible. When it comes to cervical cancer, if you have any abnormal bleeding, or even maybe any fall discharge which is coming out, or even any pain maybe during the time that maybe you are maybe having some, what we call the reproductive engagement. So if you have pain, what we call dyspareunia, I think it's important you take an action.
Agreed.
When it comes to esophageal, if you have any difficulty in swallowing, which usually starts with the solid, then liquids, I think it's good you take precaution as early as possible. Then for things like prostate, if you have any difficulty in urination, maybe you are having, it's coming out slowly, and so you need to take precaution as early as possible. Or even for colorectal, which is number 5, if you have any bleeding in the stool, or you are seeing some blood in the stool or so, you need to take precaution. So knowledge of how these things manifest is usually the first way to prevent or even diagnose. And if you have that knowledge, you will help yourself first in order to prevent this. So what we are telling people is avoid things that may expose you to getting cancer. And apart from that, have the habit of self-checks. And also what we're encouraging is families even to take precaution in terms of having the regular family checkups every 6 months or even once a year. Take your wife, take your children for just general checkup, and hospitals are able to do that and even detect early.
Beautiful. Remember, this is a conversation around the state of cancer in our country and the steps that are being taken by government to ensure that service delivery is no longer a problem. Each and every Kenyan can access treatment and medical services when it comes to cancer. Just transforming the whole cancer approach in Kenya. And we welcome your questions if you have any in regards to this matter. And there's a question that has been directed to Professor. Valerio is asking, are we going to be seeing professionals also coming to Kenya for training, because you have mentioned the whole aspect of global standards?
Yes, so that's very much part of the development of this Centre of Excellence in Kisii County for healthcare and training. And we very much see this as a bilateral relationship whereby we'll have professionals coming here. And in fact, as we talked about the economic benefit of keeping people in Kenya for PET scanning for cancer, over time you will be able to generate, if you like, international students coming into this country from outside of Kenya for training in medicine and nursing, and that's what makes the whole healthcare system sustainable. So if you have those global standards that the partnership will work towards around giving you that assurance that this is at a global standard, actually you can generate work and training for people coming into Kenya from all over the world, and that's a really exciting opportunity. Yeah,
the question of quality, you know, we just I think this is someone who's speaking from a point we just don't want to go there. You should also send people over to our country to learn.
Yes,
now,
absolutely.
Yes, the next question, maybe Dr. Joseph, you could address when it comes to making sure these services get to the local Mwananchi down in the village. Looking at the rural setup, again, it's something that I know you had touched on, but again, it's a question that has been asked.
Thank you. I explained about the establishment of the primary health networks with our Cuban family physicians who are already in the country, the ones we trained in Cuba. We have decentralized them to the counties. And what you are finding is that they have established a system of where they can visit the level 4s, visit the health centers, and visit even the dispensaries, and be in touch also with the community health volunteers who are manning the households. So the primary health network that we have established following our UHC strategy is what will be able to ensure that. And of course, what are we also doing? There is the reverse referral that we are looking at. There are mobile equipment that will also be available. Things like cryotherapy machines, colonoscopy machines, which are portable. They will be going with them to the lowest level possible, even up to the household.
All right. Now, a final one from Faith the Thinker. She says, I love this work that is being done when it comes to cancer treatment, but you should also focus on maternal health care. In as much as it is free in public health care in facilities, it still remains to be wanting. Yes, that is all I can read for TV. Again, the question of maternal health care. This is all in line with the universal health coverage, ensuring that you get any medical service at an affordable price and it is of good quality. Now, that brings us to a close of this conversation. I don't know if you have any social media platforms that our viewers can engage with you later. Joseph?
Yeah.
Are you on the social media platform?
Yeah.
How can our viewers interact with you?
I'm on Twitter at Joe Lanai.
Joe Lenai?
Yeah.
All right. What about you, Professor?
We don't have a social media platform, but actually I think we do it through our partners in Kenya.
Yeah, I think
Fantastic.
also MOH has a platform.
Yes, MOH, yes.
Yeah, and
All
I think
right.
that's also another platform that we can engage in.
Digital, embracing technology.
Yeah.
Exactly.
All right, now that brings us to a close of this conversation. We have been speaking with Dr. Joseph Lanai, who is the Director of International Health Relations, working under the Ministry of Health. We have also been speaking with Professor Graham Lord, who is the Vice President at the University of Manchester. Thank you very much, gentlemen, for making time to be with us today.
Thank you, Jane.
Thank you, Jane.
All right. Now, we are not done with Good Morning Kenya. We're going to take a very quick breather. We will be back with more that we have lined up for you. Do stay with us.